All right. Hey, good morning, Pagosa. It's Friday. It's the last day of May already, and it's a beautiful morning. We're going to get to our Pagosa Springs Medical Center show here with Dr. Rhonda Webb, CEO, CMO, and Jodi Scarpa, Manager, Foundation, and Community Relations. Good morning, you guys.
Good morning.
Thanks for dropping by so early.
Thanks for having us.
Glad you're here. Get real close to those mics. They're working today.
Okay, good.
We are on the
air.
And I'm glad you're here because, we'd like to know what's going on at the hospital. It's getting to be summer, and it's a busy time.
Yeah. Well, summer season is clearly here for us,
along
with lots of visitors. And, we're not as seasonal as we used to be, but still, the summer is our busiest time of year. We've seen an increase in the patients in the emergency room. They're seeing an increased volume, and we've added another provider to assist with the volume. Waits may be a little bit longer. Anyway, can't help that if 8 people come in at once, they can't all be seen exactly at the same time. So we're really happy to see people using our hospital and everyone who supports us. We are, I'll tell you that we have some new physicians and advanced practice providers. We had a very stable medical staff until I bragged about it in January. A few months ago, people have left to go be with their family of aging parents, or they left primary care left primary care. So we're sorry to see that happen, but we're very excited for these new providers that are coming. Becca Munich-Husen is a physician assistant coming to primary care. Shelby Aragon is a nurse practitioner who is from this area.
Yes.
And she is coming into primary care. Emily Barber is a nurse practitioner who already lives here. She's going to come into our clinic and support essentially our subspecialty clinics, like our part-time cardiologist, our part-time neurologist, just to make sure those patients have some continuity of care and support. Marlena Wosiski-Kun, she mostly goes by Marlena Wosiski, is coming in. She's an MD and a PhD, and she's coming into our emergency department to work. She's got experience in critical access hospitals and knows what it's like to be out here where you are seeing big cases and don't have the support you might have at a bigger hospital. And then we have Dr. Emily McIntyre, who is coming to primary care also. So we're very excited for all these summer starters.
That's
amazing.
That's serious. A lot of people.
Yeah, and we have I've already talked before in that Dr. Jeremiah Steed is coming. He's a orthopedic surgeon who will have a certification in total joints. My husband would like me to probably remind you that he is not retiring. He likes to operate. And so, but Dr. Steed is from here, actually, Jeremiah Steed, and he is coming in September. And so we're very excited to be expanding our orthopedic department. In addition, we have a new cardiologist coming on board this summer in July. Dr. Lambert is retiring for the second time. He retired when he came out here, 8 years ago, Jodi?
Yes.
He didn't like not having some patient care to do, so he came out, and for the last 8 years, I think he's been working in our clinic, and he is retiring. But Dr. Scott Smith will be starting in July, and Dr. Lambert will be leaving in July, so there's a seamless transition for our patients for cardiology care.
He reminds me of Dr. Lambert.
He is a lot like Dr. Lambert.
Yeah, he is.
Nice guy.
Yeah.
So that's good.
It's always good to have nice guys.
Right. Oh, yeah. He's been here on the radio, too, Dr. Lambert. We'll have to get Dr. Scott over here.
Yeah. We'll do. They like to talk, so that'd be good.
Excellent.
What's going on with you, Jodi?
Well, I am busy in the community relations office preparing for the annual summer gala that we're having at the Alley House on June 17th from 6 to 9. Call me if you're interested in going. The decor, this is, we're putting it together in the Dodie Cassidy building. It's all laid out on tables. We're having the Tim Sullivan Band, and it benefits the renovation of our medical wellness building on the corner of 160 and South Pagosa. Really excited about that. A lot of work has gone into it, and the
medical wellness building, formerly known as Dr. Pruitt's office, because Dr. Pruitt had that as a medical office for a long time before he retired. We are fundraising for that this summer. We have it in our budget for this year I think they're supposed to start as soon as we get that permit.
Yes.
This next month, and I think they'll start in June. They're ready. We're just waiting on the, powers that be and to get that permit in. So it shouldn't take very much longer. What we're going to do in that building was we can't afford
Pretty good sized building.
It's a big building, but we can't afford to remodel all of it. So we're remodeling the downstairs first because the upstairs you really have to have an elevator to go there, and that adds like another $500,000 to your budget. So we're going to do this a little at a time, and but we're very excited about it. Nunn Construction is doing the project, and they've done a lot of work in this area and in Durango, so we're excited about that. And it will be mostly, the bottom floor will be mostly expansion of our physical therapy services. There's still big waits in this community to get into physical therapists. We have some really great therapists, both at the hospital and outside the hospital, but it's just, they're just not, it's a shortage, so we're going to expand over there, get a little bit, get bigger, hire some more employees, and we'll also in that building have a classroom for education for the community. We'd like to talk about wellness and preventative care, and we are going to use part of that space to do some pain management procedures that are currently being done in the area close to our operating room, in like our pre-op area and post-op area, but our surgery volumes are consistently high, and we need to try to offload some of that from the OR, over into this wellness building when that happens. So we're excited about that.
Mm-hmm. And it's exciting. The community will see that the construction fences are going to go up next week along South Pagosa and Highway 160. We're excited about that. And the roll-offs are there for the gutting of the building.
Yes, we're excited. Well, we wanted to just get a bunch of sledgehammers and go in there, but apparently
I know demolition is
some fun. I know. We've thought about it, but we don't know what would be there, right? So that's not our specialty. So we're going to let the people do it who know how to do it. We were able to donate some of the
materials,
because
that is
cabinets and things like that.
Recycle, building.
Yeah, Habitat for Humanity actually, I think, came in and took the cabinets. So we're trying so they can use them in some of the houses, and so trying to do this in a thoughtful way. Yeah. We are going to do also more sports medicine in there, teach people about injury prevention, right, rather than just treat injuries. Right. So, we're very excited about that. Another thing I can tell you is that on Tuesday, our board heard an analysis of a service line of pulmonary. So just like me, I'm a specialist in internal medicine with a subspecialty in kidney disease. Dr. Lambert, subspecialty in cardiology, and we're getting a new pulmonary function machine that enables us to do the complete lungs, complete lungs. And we are just as of probably next week, we'll start recruiting for a full or part-time pulmonary doctor or lung doctor, because we know there's a big need in this area, and so that's all just happened this week. So it's hot off the press.
It's really exciting. And Rhonda, what does a pulmonary function test look? I mean, not the test, but the equipment look like? It's
a little booth. Actually, it's a booth that you close you in there, and then you're just going to breathe in, breathe out. They'll give you instructions, and it checks both the lung volumes, and it helps us know what kind of lung disease you might have, how stable it is when you start, if you do have lung disease and you are on treatment for that, and they just check these. It's a expansion of what our current ability to do pulmonary function testing is.
Because when you go into primary care, they test your oxygen level. I guess that's a little different.
That's a pulse oxygen. That's the first thing. That's the vital sign, right? So it really is. Vital, they do check that, and we're at altitude, as everybody knows, and so we have a lot of people who live at altitude with lung disease, and they're on oxygen, and so we another thing that kind of plays off here, we are going to build our building this at the same time as the remodel, same company, to generate our own oxygen. Most hospitals in the United States do not do this, but we figured we're like an island. And they do this in Alaska, and they do this in Hawaii, and they do this in Guam. Mm-hmm. And so
we are like that.
We are like an island. And, and we don't have enough
different
oxygen.
Climate, but we're like that.
Right. So we need to be, we're kind of last on the list for deliveries. And, it's very complicated to do all that. So we're excited to be paying for a building that we can generate oxygen. We're not going to be selling oxygen. That's a DME, a company. We don't do any of that. But it will enable us to have a steady stream of oxygen. We talked about this actually before the pandemic, and then during the pandemic, we did have 2 days, one in 2020 in November and one in 21 November, where we could not transfer patients out who needed high flow oxygen and even ventilators. Wow. And so there were no beds available anywhere, and so they stayed here, and we took care of them, but it became readily apparent that we need to be able to do something more for our community with oxygen. We did get supported with grants from the El Pomar Foundation and the Department of Local Affairs, also known as DOLA.
Right.
And HICPUF. That is HICPUF.
In unison.
Yeah.
In harmony. HICPUF?
HICPUF is our Colorado Department of Health Care Policy and Financing.
Okay.
I don't know that that's exactly their...
Yeah, it is. It sure is. And we're grateful for it.
HICPUF pays us for state Medicaid. Mm-hmm. That's HICPUF. And so they pay us less than it costs us to do business, but they do pay us.
Right. Well,
anyway,
it all adds up.
We're just super excited about that.
That's exciting. That really is.
Yeah.
So we're speaking with Dr. Rhonda Webb, CEO, CMO of Pagosa Springs Medical Center. Also, Jodi Scarpa is here, Manager Foundation and Community Relations. Take a quick break, check on the river, and then we'll be right back. The river it stayed exactly the same as last night. It just looks like a mirror image of yesterday, the night before, that is. So I didn't change the report. I just left it the same. And Nicole isn't here yet, so she'll be back soon. The Pagosa Springs Medical Center. What else is going on, you guys?
Well, we're right in the middle of what is Hospital Week and Nursing Week.
Oh.
We're just honoring our employees this week, mostly with food.
Mostly, we love food, and this year, a difference is we have fun games.
Yeah, we had a carnival kind of a thing. Yeah, yesterday.
It was fun, and bingo, and guess each other's pets, and the prizes are food, and we're grateful to the sponsor, our community sponsors, who gave us gift certificates. And
some restaurants did, and of course the Springs did. We have just a ton of community support, Alley House and Riff Raff. We've been very, very lucky as far as all that goes, to people that really appreciate our employees as much as we do. I tell people I have the best job in the world because I get to lead an incredible group of people that are dedicated to taking care of the health of this community. So it's exciting.
Yeah, they really are, yeah.
And Jodi, what's
team.
Going on Monday?
Monday is Archuleta County, by proclamation of the Archuleta County Board of County Commissioners, a Wear Pink Day in honor of cancer survivors. And it's the kickoff to the Tough Enough to Wear Pink Rodeo, which will happen on Friday, August 2nd.
Yeah, last year's Tough Enough to Wear Pink Rodeo was the first here.
Yes.
And it was quite successful. It was well attended, a lot of, and we actually were able to also raise some money, although that's not really why we did it. We just did it to
support,
just to remind people that, people, once you've had cancer diagnosis, it changes how you think about life and whatever. And so it's an exciting thing.
Mm-hmm. It is. We're in the middle of planning for next year. I know that there's only going to be 3 heads shaved, and one of them is our Archuleta County Sheriff, Mike LaRue. And he's usually has his head shaved, but he's going to grow his hair out for it. So that'll be interesting.
Right.
We're going to keep the stick pony race, and
that was exciting.
Yes, and have a bra decorating contest. So
They will not be wearing the bra.
they won't.
They will.
And if they do, it'll be over clothes, and it might be the Cowboys. So we'll see how that plays out.
We're so grateful for the Archuleta County Fair Board and for the many volunteers that are there, and that just in general, and then especially for this night. It went really well last year, and it was super. Friday, August the 2nd.
Yes, ma'am.
Lots of excitement.
Let us know how we can help here at the radio station, Jodi.
Sure. I will do.
We will. But join us on Monday in Wearing Pink. Thank you.
Monday. This Monday, June
This
3rd.
Monday, yes.
To recognize cancer survivors.
Yeah.
Awesome.
Well,
Sounds like we got it, huh?
think we're-
Most of it.
Yeah.
There's a lot
I always
more.
like to remind people that
Yeah.
the hospital owns the ambulance here.
That's right.
That
We
is
always talk about that.
I always talk about that
Jason was
because
here last time.
we really want people to know that when you call 911, we have great dispatchers that are not our employees that are at the county,
Yeah.
but then the ambulance. I mean, all of our first responders are just so valuable in this community. They were out yesterday.
Yeah, I got
full
calls
force.
here. What's going on out there? All the sirens and
Yeah.
helicopter and so anyway.
There was a fire,
Okay.
but there was
Over
some other
in
things happening at the
Aspen
same
Springs?
time.
Couple
So
of
we
things
had
happening,
4 ambulances out at the same
Gee,
time. So it's
yeah.
exciting. It was an exciting
is
day. at the
Too
hospital.
exciting.
Too exciting.
We have a scanner upstairs, so people call and say, and I hadn't been listening, so I was kind of clueless. I'm sorry, I don't know, but I see and hear things.
Yeah.
Sorry, I know
That's all right. It's
gets you guys
exciting,
busy,
but yeah.
and, hope everything's okay.
And
Well, that's what we're
everything
there
was
for.
okay. I heard, and also want to thank everybody who's listening for using our services, for donating money for our capital plans. We run a tight margin like all rural hospitals, and we want to be independent. We don't expect to need to have a big system by us, although it might be inevitable one day, but not right
on our
now.
watch.
Not on our watch. That's
No.
right. It's we just don't want to be run by the people who think that Colorado Springs is south, which would be the Denver people. I mean, there are great hospital systems out there, right?
Sure.
But they don't understand rural all the time. So.
Okay, well, thanks so much, Dr. Rhonda and Jodi. Good
Thank
job,
you,
you guys.
Will.
Thank you, Will.
It's always great seeing you and hearing what's happening at our hospital. We're so proud of our hospital and so appreciative and grateful. So, thanks.
Thank
And
you.
Up next is our Western Daybreak Ag News. We'll see y'all later. Have a great weekend.
You too, Will.
Okay.